of you that have just joined, we will be recording the meeting, so I hope no one has any objections to that. I'd like to welcome you all to the launch of the Age Well programme pilot for Enfield and Haringey. This has been developed over the last 18 months or so with an amazing programme team that I will be introducing in a little while. We have quite a tight agenda. I'll just, for those of you that don't know me, my name's Kerry Ahern. I'm one of the programme leads here at the NCL Training Hub, and I'm leading with one of my colleagues on the Age Well campaign. Can I ask, for those of you who have just joined, if you don't mind putting your names in the chat and saying what your organisation is and what your job title is as well, that would be really helpful. And I'd like to extend a really warm welcome to Councillor Lucia Das Neves from Haringey. It's always so great when one of our elected members, our local elected members, comes to one of our health and social care events. So thank you very much, Councillor, for taking time out to attend. If I can just very quickly introduce you to the Age Well programme team, there's myself and there's my colleague Carrie Matthews from Haringey Training Hub, who are the programme leads. And the team is Rabina Allen, Fanny Nagan, Noor Masood and Elizabeth Canales. And I think straight off, it's really worthwhile saying a huge shout out to Ellie Canales, who's really been the driving force behind this programme. And as you will see as we go through the programme, the beautiful website, Rabina has done amazing work on a lot of the graphics as well. And we hope that as we take you through the programme, that you'll see all the hard work that's gone into it. And we hope that as well that you will tell your friends, tell your colleagues about the programme across the two boroughs. We will be giving you a QR code later on throughout the hour for you to sign up to immediately become Age Well Friends, if that's something that calls to you. And we would ask you to spread this out to your teams as well. Can I have the next? The slides up there. So I'm just going to now pass you over to Paul Allen, who's the Assistant Director for Strategy, Communities and Inequalities, who's actually going to talk about a little bit about the older populations in both Haringey and Enfield. We've got quite a tight schedule as there's a lot of people being involved in this that want to present. So if you have any questions, please put them in the chat. We will be monitoring those and there will be time out at the end for those. And over to you, Paul.
Hi everybody, I'm just so proud that we've got to this day actually about launching the Aging Well Friends Champion. So I've got a bit of a kind of an introductory slot. So if we go on the next slide, thank you, it's perfect. We are I thought I'd start out just describing some of the demographics of things that we know about the older population in Haringey and Enfield. And we know the figures are there, 110,000, 77,500 people aged 50 and over. Sorry to anybody like me who's over 50 to be describing as being in the Age Well arena, but it comes to us all, I'm afraid. And of those, we know about 34,000 and 20,000 are aged 70 or over. So what we do know is that actually not only is it a real issue now, which I'll come on to in a moment, the population is actually going to grow significantly over the next 10 years. And I've put there a couple of graphs to show that growth. It's going to be much higher in the older age groups rather than the younger age groups. So what we're doing now really in some respects is investing in kind of giving information to people and advice and so forth that will hopefully kind of put them in good stead if they are kind of 50 or even younger than that now, because 10 years time, they do the maths, they're going to be older. We know that it's both boroughs are very diverse, and that includes people over 65. A lot of the growth in Haringey, for example, is in groups who are non-white British, but we've kind of listed down there some of the large populations of residents who are 50 plus, Black, African, Caribbean, Greek or Turkish, or Greek, Turkish, Cypriot, or Eastern European. And on the right-hand side of the kind of slide, There's also just a quick map of the deprivation map of kind of Enfield and Haringey using the Older People's Income Index. So what we do know is that most people are kind of living in the wests of the borough who are over 65. But that doesn't mean to say that we shouldn't be concerned about the people living along the A10 corridor, for example, who are maybe a bit younger. And I'll come on to one of the reasons for that in a minute. But those living in the 20% most deprived areas, we know this is a national issue, and it's true in Haringey and Enfield, and maybe it's less likely to come forward for advice on their health, including diagnosis. And often they're at 30% or more a greater risk of having a particular health condition, which obviously triggers kind of aging, if you like, in some respects. So if we go on to the next slide, I was looking around for a quote which actually would summarize what this is all about. And I think, quite reasonably, the World Health Organization had a really good quote, which I've kind of spent a bit of time pulling out. And it's just important to recognize that kind of longer life brings it with its own opportunities. This isn't the NHS kind of saying you must get well because it's going to save us money and resources and so forth. This is about helping people, um, age well essentially, and contributing, because we know older people themselves kind of contribute in so many ways to families and communities. And obviously, as it says there, it's often reliant on their one factor, their own health. So we know that the proportion of life in good health has remained broadly constant, and I'll come on to that in a second. So that the additional years over time have been in poorer health. But it's really possible that you turn the dial on that. You could, if you're relatively fit and well, continue to be fit and well as possible until later years. And it's maybe about maintaining good health and healthy behaviors, about eating a balanced diet, having regular physical activity, all the good stuff that I'm sure you all know about as well. We do know there is an issue in Haringey and Enfield in this space about healthy life expectancy, which is a measure that relates to how many years the average person can expect to maintain that good health. It is actually it's not moving significantly in both boroughs. It's still hovering around 64 to 65 years in Enfield and Haringey, and actually the gap is even more stark between the most deprived and the most affluent kind of areas, a 15-year gap in healthy life expectancy. So you could see there why this is a real issue for us. And actually, there are very simple ways that we can actually sort of turn the dial on that. And as an individual, we could all kind of change our diets, eat more, drink more water, eat more healthily, and so on, take more exercise. And there's loads and loads of those sorts of tips that are on council websites, which I'd urge people to look at if you haven't seen it before. A bit of a shout out to the Aging Well Guide, which we did a couple of years ago. It's very popular. And that's got a whole range of tips. And the idea being that these are things people can do for themselves. And actually, they may not know or consider about some of the issues. One of the things that we did want to recognize in this space was that actually the issue isn't about somehow adopting a healthy lifestyle alone. We recognize that actually some people are really struggling, full stop, and it may be that actually getting to the end of the week is a goal for some of those individuals. So if I take one example of that, we know that 1/4 of people who are over 65 in Haringey or Enfield residents, according to the council surveys, report there are sometimes or often lonely. Now, when you apply some of the research that's been done in this area, for example, if you're socially isolated, it means that if you've got a long-term condition, you're now 59% more likely to have an exacerbation of that condition just simply by being socially isolated. So we know that there's a whole range of factors about the causes of the causes, if you like, around long-term conditions. So this is really about trying to get your help in two ways. First of all, we need to make sure that although we've got a wealth of information, and you'll see that in the websites, but they're brilliant, they really are, that we can kind of give to people, we do need a network of people to try and help us promote some of these things. So what we need is a network of people who are sufficiently knowledgeable, friends or champions, who can better understand all the people's needs and give them some even basic advice, or just simply point them in the right direction for help. So we really want to make sure that that network really reaches into kind of underserved communities and groups. And I hope you realize why I'm saying that from what I've just said earlier. to really effectively tackle the inequalities gap as well. So I said I was going to talk for 10 minutes. Kerry bet me I'd waffle on for ages. So that's the end of my slides, everybody. I'm happy to take any questions or any observations people have got, but I'll leave that. I'll hand over now back to Kerry.
That's great, Paul. You've made a liar out of me, but I can live with that. Thanks very
I'm
much.
just joking.
No, that's great. And I kind of think, as well, what you were saying, I mean, living well isn't just about, sort of behavioral change in terms of, healthy eating, exercise and all that. It really is about, we know people live better and have better life years, around if they are connected with other people, with activities, and with meaningful interplay in their daily lives. And that can sometimes decrease as people age, as they, perhaps stop working or become some sort of physical conditions come that they are unable to perhaps participate as well in community activities. So let's just talk about the program. It focuses on creating age-friendly environments, but through the collaboration of everybody. So individuals, businesses, health services, local authority services, VCS services, to promote well-being and inclusivity through improved support for the older population. And the aging population. We've got 2 phases to the program. The first phase is today. Can I have the next slide, please? These are the 3 phases of the program: Age Well Friends, Age Well Champions, and Age Well Experts. Today we are launching the Age Well Friends and the Age Well Champions part of the program, and the Age Well Experts will come later. Next slide, please. So we're going to talk about, the pledges now. Actually, Ellie, can you take me back to 2 slides back, please? Just because we just went a little bit quickly. So just to sort of talk about the differences between the 3 elements of the program. The Age Well Friends is really about encouraging individual people and businesses and organisations to pledge their support for older adults within both Enfield and Haringey. And we're hoping that by pledging this, it will raise awareness within your organisations about ageing related issues, and for you as individuals and as businesses or organisations to contribute to a more age positive and age friendly society. Our Champions includes a training program, and that's designed to better support the needs of professionals, I guess, for the aging population. And we've developed a program of a training program of different modules for people that sign up to be champions, to be able to gain skills, to improve their skills, to improve their knowledge, to help drive change within their local community. And also as a way to sort of expand knowledge of different types of services. Many of you on this call will know that one of the key problems in trying to support our residents is that we don't always know what services or what are available within a local area. So we're hoping our website and our collection of resources will really be one of the go-to places that professionals can go to be able to identify support for their residents or their patients. And phase 2 is going to be about Age Well Experts, and we'll be looking at developing support for people who are defined as experts in the field of aging well, and that may be people who have been working with older people for 10 or more years, or otherwise have done particular study on working with older people, and that's a program that will be that aspect of the program will be rolled out within the next couple of months. Oh, can I have the next slides, please? And the next one. Thanks. So this is introduction to the pledge. And if you want to become an Age Well friend, you can sign the pledge here. And we're really hoping many of you will do that throughout the call, and we'll be filling in the you just have to click on your QR code, and as you can see on the right hand side, there's just a number of fields that you need to complete. In terms of the Age World Champion training program, there are a number of modules within this program. We have worked quite tirelessly with a number of clinical staff, with voluntary sector staff, and also with our local authority colleagues to develop a number of modules. To become a champion, there is a mandatory module which is entitled Building Resilience, Independence, and that includes quite a large section on frailty. And then there are optional modules which you can see there, which include things on falls prevention, dementia, mental health, a module for those supporting family carers or unpaid carers, home life, and this is going to be really important for people who may be coming up to retirement or have just recently retired. And we are also including something on the self-management of long-term conditions that, again, professionals will be able to signpost people to. In terms of those who can express their interest to become an Age World Champion, there is a list here. So lots and lots of healthcare professionals, but also day centre staff, social workers, community pharmacists, and other VCS staff with a special interest in age well areas. So, for example, we've got the wonderful Alison Carter on the call today, who works for Age UK in Enfield. Many of her staff would probably be able to do a lot of these modules with their eyes closed. So people like that we would hope would be signing up to be Age Champions, Age World Champions. I think that's it for me. Is that it for me, Ellie? Do I now pass? I do. I now pass on to Rubina, who is part of the project team, and Rubina has been working almost single-handedly to with support to pull together all the information on Age Well Friends. So, Rubina, if you're here, I'll pass on over to you.
Thank you, Carrie. I am. I'm really pleased to be here today to officially launch the Age Role Initiative. It really does mark something special, in terms of a movement towards creating a more inclusive and supportive environment for our older population. As Carrie's mentioned, the team have worked really hard to discuss things, review things, and come together to create something that will be beneficial. So we'll have a toolkit. But before we really delve into what we're able to provide, we wanted to just give you an overview of the benefits and why becoming an age well-friendly organisation would be of use. Forgive me, I'm in the office and there's lots of activity going around. So if at any point you can't hear me, just give me a little thumbs up to go a little bit higher. So just the benefits of becoming an age well friendly organisation. Becoming an age well friendly organisation isn't just about making small changes, it's about transforming how we engage and support with our older people in our community, whether it's your clients, your customers, your volunteers, or even your colleagues. It's about enabling us to better meet the needs of our older people by offering services and creating environments that are a lot more inclusive and actively welcoming. And this doesn't make a difference. And this doesn't just make a difference to them, but also benefits your organisation and enables you to stand out. So when we're looking at our guide, at our benefits here, we're going to look at inclusivity, and being age well friendly makes you more people friendly. It's a win-win for everyone, as you're creating a space where adults can be recognised as equals and an integral part of the community. And this is something that people notice. And then there's staff engagement. With the professional development opportunities like age well awareness trainers, your team will be able to grow both their skills and compassion, and you'll see better retention and positive work cultures, which is something everybody can really get behind. But of course, with every business, there's always that benefit to you and that side. In terms of a great experience will lead to repeat businesses and a welcome environment, which means people will come back and tell others about what you have to offer. But above all, it really does is create a community spirit, and that's what being an age well friendly in organization really does encourage. And becoming an age well friend isn't just about your organization, but it's about making the whole community feel like more connected and inclusive and more alive. With that, it says lots of great benefits, but what is the actual commitment to do this? It's simple. It's really about making a genuine commitment to social change. We're asking whether it's your management or your staff just to be working towards creating a more age well friendly environment and to embrace the social inclusion and the values of our aging population. So simple things like reviewing your current policies, by making meaningful changes, creating awareness among your staff. Will support with this commitment. You can follow things like the age well principles, and yes, you can display one of our age well friendly sign symbols in your window so that everyone knows that you're standing behind this and it is something that's extremely important. This isn't a quick fix, and this is not a one-time or one-off proposal that we're saying to sign up and pledge. It's a conscious and consistent decision to make change, to make our environment and community a better place, not only for our aging population, but for everyone in the community. Thank you. Ellie, can we go on to the next slides for the toolkit, please? Now, it would be no good if I told you about all these benefits and then all this commitment without us providing you with some resources. And our age well toolkit and resources are packed with the various of different resources to help your organisations really thrive and support our older adults. And this is something that we've been working on with specialists that Carrie's mentioned, and we'll continue to try and maintain and keep on top of so that the information that you have is always at hand and what you need. So this includes everything from mental well-being strategies to healthy lifestyle workshops like nutritional advice or sleep hygiene tips. It also includes directions of health screening and where we can point you into the right directions. Or if you're looking at your own staff, looking at flexible working options and just pointing you in the right direction. So ensure that you are supporting your staff's well-being and also. But that's not all. We also have creative ideas because some people want to do a bit of art and music or music therapy or looking at garden initiatives, mind, body and wellness programs also. And what's really important is that we try to focus within the borough. So we're not sending our older people within our boroughs out of the area. We're using the resources that we have within Enfield and Haringey and really trying to connect that piece because we do have a lot. And we've even thought about talking about chronic disease management because we know we want organisations to feel empowered to support everyone in a holistic way. And most importantly, as I mentioned, everything is based within Haringey. So we've given you a kind of a toolkit so that you can connect with local organisations. So you'll have all their names and numbers in that way to connect to them. So we're really excited to be launching this programme, and we're super pleased to have so many people that's here to see about the benefits and how we can engage. And we will continue to support you in any which way we can to make it a successful pilot. Thank you. Can you go on to the next slide, please, Ali? Just before I go, we did have the North London Chamber of Commerce and Enterprise who were supporting the project, but unfortunately they couldn't be here today. So they've shared this message from Despina Johnson, who is the CEO of the North London Chamber of Commerce and Enterprise. They are committed to supporting and enabling a more inclusive community, and we are wholeheartedly supporting the Valuable Age Well Friends initiative aimed at engaging businesses located in Haringey and Enfield to commit to creating a more age-friendly environment. The Age Well Friends pledge, along with the resources such as the toolkit, will enable businesses to support the well-being of their staff, customers and clients who are in the older age groups by promoting awareness of aging issues. And we will encourage them to make a positive change to support the 50+ groups in a whole range of areas. We will encourage businesses in our network in the North London chambers of commerce and enterprise, and our wider mailing list of a business to commit to the pledge. So hopefully that will also encourage you guys to join us also. Thank you. Enjoy the rest of the launch. Thank you, Ellie. You're on mute, Kerry.
I am on mute. Yeah, thanks so much for that, Ellie. Sorry, Ellie, Robina. I hope, and I think it's. I'm really delighted that the Chamber of Commerce will be promoting this to their businesses and to their members. I'm now going to pass the chair over to my colleague Carrie, as unfortunately I need to leave. So Carrie, if you can kindly take up the baton and introduce the next speaker. And just like to say thank you all for coming to this, and Carrie will continue to promote, to chair the launch for the rest of the time this afternoon. And please, if you have any questions or any comments or anything that you want to add to any of our resources, there will be an email link that you can use for that. Okay, thank you very much.
Thank you, Carrie. Hi everybody. As I said, my name's Carolyn Matthews. Everybody calls me Carrie, and I am the Haringey Training Hub lead. Just to continue, I'm delighted to say the next number of slots, we've got the most amazing presenters coming up who are each going to do 5 minutes presentation with the support and the knowledge of Aging Well. And I'm delighted to say the next person we're going to be asking to speak will be Nadine Geel. Nadine, are you there?
I'm here, but I thought Ross was going first.
Oh, I do apologise. I saw
So
that
I think
slide up first.
Yeah, I agree. I was just about to say, I think we need to go. I was putting it in the chat. I think we need to go slide up. So you've got Ross first.
I don't mind, Nadine, but yes, I'm
Ross,
here if you want me.
Thank
Can
you.
I share my screen then? I just want to share. Hang on, and see if you can see a PowerPoint with some funny looking Christmas tree pictures on it. Is that?
We can see it.
Is that visible? Okay. So just a little introduction. So my name is Ross. I'm a GP in Everton Green in Enfield. I'm one of the clinical leads for Aging Well for Enfield for the ICB half a day a week, which is sort of where I've got involved in this and various other things around the borough. I have a background in obviously general practice, which is my core job, but also in frailty and quality improvement. And I've done a very short presentation, I'm aware it's only a few minutes, about why medically this is important. So if you look at these funny shaped Christmas trees, they are demographic trees, are based on age, looking at our population. So if you look at the left one in 1966, we had very, very few very elderly people. We had a few who made it to like in their 80s, 90s, and 100, but most people, men on the left, more so than women, were dying in their sort of 70s and 80s. People were not reaching a ripe old age because they would die of medical problems. They'd have a heart attack and they would die, they'd have a stroke and they would die, and medical care and drugs and innovations have changed that. So you can see from 2016 where we were sort of 8 years ago, and you can see where we are headed in 2026. And what you are seeing is you're having lots more very, very old people, not an infinite number, but certainly people who previously, much bigger numbers, a much bigger proportion of the population. And that's why this is all very relevant, because if you want to know where we're headed, go and visit Japan, which is ahead of us in the demographic curve. So it's an interesting topic. It's a very relevant topic. I intend to be alive in 2066, at which point, if my sums are correct, I will be 79. So we all have an interest in this working well for us if we want to get to where we aim to be. So a little bit about what frailty is. Frailty is something that has been difficult to define, but essentially from a medical point of view, so as a clinician, it's increased vulnerability to illness, poor recovery, so homeostasis, poor recovery after you become ill. You can't become ill without losing function, so being bedbound or falling on the floor or being confused. And I added the last one, but it's a tendency to become dependent. So a good way to picture this is this slide. If I'm as a mid-30s fit and well person and I get COVID or the flu or urine infection or whatever, I'm unwell, I feel rubbish, I might be in bed for a day, I recover, and I go back entirely to how I was before. With a frail person or a free frail person, they're only just managing. They get ill and they're confused. They're in bed for a week. They're in hospital. They deteriorate. They physically decline, and they take a long time to get better, and they never get back to where they were before. So there's always this increased risk that we all see with our very old people. A key thing about frailty is most frail people are old, but not all old people are frail. Okay, most people with lung cancer are smokers, but not all smokers get lung cancer. It's an important distinction. It's not about being ageist, because there are 90-year-olds running marathons and there are 97-year-olds presenting awards and TV shows. So frailty is more common in the elderly, but it's not exclusive. The definitions are based on people medically over the age of 65. So we're looking at people in the later stages usually. And the way we classify frailty in terms of something called a Rockwood score is how well someone's been in the last 2 weeks. And you would see, you can look this up, the clinical frailty scale is a way of measuring how likely someone is to need support or how at risk they are of becoming unwell in hospital admissions and so on. So this is worth looking up. I won't dwell on it now, but the Rockwood score or the clinical frailty score, I encourage you to have a look at. Frail people tend to present syndromically, so they don't tend to have acute symptoms. They have falls for a variety of reasons. They have immobility, so they take to their beds for a variety of reasons. They get confused for a variety of reasons. They become incontinent or have constipation, and they get lots of side effects from the lots of medications we like to throw at them. So these are frailty syndromes, and people who are frail do not present in the black and white textbook ways that medics like, with abdominal pain or chest pain or headaches or vomiting. They present as a fall, but there may be much more going on in that. And actually, the reason for the fall might be because they've got appendicitis. So understanding that frail people are different to necessarily young people in presenting in the way that historically we have is important. And that's why this is very relevant medically. You can see that frail people, usually in the advanced ages, have much higher needs based on payment for support, for care, for public services, for hospitals. So, you know, we are going to have to manage a bigger proportion of our population needing much more from us, and this is a way of proactively managing that. If you look at what happens, and there's some rather boring Kaplan-Meier graphs, is that if you're frail, you are much more likely to do badly from being very unwell. So getting into hospital, while sometimes important, is not a good place for frail people. Ideally, they are managed much better at home in their own environment, rather than toppling into hospital, being in ambulances, being in bed. They do very poorly in institutions. They do much better with support at home. So if you're frail, so if your Rockwood score is 7 and you end up in ITU, you have a very, a 35% chance of survival a year compared to someone who's not frail. So frailty is a big predictor of mortality and morbidity, independent of age. It's about robustness. So, you know, I like this picture because what we sometimes see is an old, frail, confused person, and we say that they're demented or they're delirious, but actually this is a person with dementia, and the nomenclature is very important. It's a person with delirium, and you know, fundamentally, it's the people that we're trying to help and trying to treat. So remember, it's not a frail person; it's a person living with frailty. Frailty is preventable or delayable. It's very, very difficult to reverse. So proactiveness, such as this program, from a medical point of view, really, really important.
Thank you so much, Ross. That's amazing. Thank you. Great slides as well. And I agree, that picture. I remember my nan saying to me, I used to get shocked looking at myself in a mirror when she was 90, because in her heart, she kept thinking she was 40. So it is an interesting thought, isn't it? Thank you very much. I'd like to now hand over to Nadine. Thank you, Nadine.
Thanks, everyone, and thanks for having me. I'm really delighted to support this programme, and my job is to talk to you a little bit about what are the benefits of the healthcare professionals engaging with this programme and why get on board. So I didn't say in my introduction, I'm the Clinical and Care Director for Haringey for North Central London, but also the Clinical Director for Adult Community Services, but I'm also an MSK Advanced Practice Physio. So the first real important reason for healthcare professionals to get on board with this is actually that we need to make every contact count in terms of maximising people's fitness and independence. You know, particularly as a physio, it's really easy to lose your strength, as Ross just talked to, and your fitness and your function really quickly. So at 1 or 2 days in bed, as Ross has talked to, has a real impact on how you can function. So even just encouraging our older residents and knowing the importance of encouraging them to keep climbing the stairs, to keep pushing back after they've had any illness, on how far they walk, on carrying their shopping, because all of those things are more and more important as we get older in terms of use it or lose it. And often people aren't necessarily giving those messages to the population as they're getting older, because either they're not aware of how quickly you lose your independence, but also people get a little bit fearful and think they need to take things easier as they get older. But we actually know you need to work harder as you get older to keep that strength and keep that fitness. So any bit of encouragement that we all give as healthcare professionals that might not be seeing somebody directly because of their physical function or independence, but actually all of those words of encouragement help people to continue doing that. And I think, as well as the second part, is then having the confidence and the awareness of what's available from an isolation perspective. You heard Paul earlier talk about the impact of physically on people's recovery of how much they get ill based on their isolation. And there are lots of, like Rabina talked to, there are lots of resources available that actually, if you know about, then if it comes up in conversation with one of our older residents, then you can help direct them and signpost to things that they may not be aware of, but that can really have a huge impact on how isolated they feel. And isolation is a huge factor in how many years you live healthily. So just that awareness, and since I've been in this ICB role in the last 18 months, I've learned so much in Haringey that's available that not everybody knows about. And actually, the more you are and we are armed with that information, the more we can use that in conversation and direct people to things that really literally might be a lifesaver. And then the third aspect of this for me, it's about also having the confidence then, if you're having interactions with older residents and they are deteriorating, then it's you having the confidence, having engaged with this programme, on where you might send somebody for help and what's available in terms of preventing that. We call it in healthcare circles rising risk, but it's about having an awareness of what symptoms people might be showing as part of their deteriorating, and then being able to link them in early before things deteriorate too much. In summary, for me, it's a bit about feeling confident to make every contact count in the widest sense of supporting our ageing community to have as many years as they can living in health. And I know we talk often about it takes a village to raise a child, but I think we might need to change that to, something more about it taking a community to support our ageing residents to age as healthily as possible. And I hope I haven't gone over my 5 minutes.
Not at all, Nadine. That was absolutely amazing, and it really does resonate with us all, I think, of what you've said. And I do feel that this program that we're doing is just building on that and is giving us that ability to signpost, be aware, and to really be an amazing community across Haringey and Enfield. Thank you. I'd like to take this opportunity now to introduce our next speaker, who is Mark Tickner from the Enfield Public Health Team. Mark, are you there?
I am. I was just trying to get myself unmuted. How are we all?
I'm very well, thank you. We're great. Right. Over to you.
Right. Just very quickly, am I sharing the slides, Elizabeth, or are you? You are.
Yeah, I'm sharing the slide for you.
All right, could I have my slides? That'd be okay? Right. Just like to let you know how we're going with the Joint Health and Wellbeing Plan at Enfield, which actually has as one of its themes age well. And the reason for that is that our joint health and wellbeing strategy has to, and I emphasize this, has to sort of parallel or align with the population health strategy, which is being done by the NCL commissioning functions of the NHS. Now, it's not just it's the practical thing to do, but it's something that we're directed to do by central government guidance. I'm not sure it's been made very clear, so we're doing that. Now, we did a big consultation process, and with the consultation process, a couple of priorities were picked out in those those three theme areas of start well, live well, age well, for us to prioritise on in the early stages of our action planning, which builds on the joint health and wellbeing strategy. Previous joint health and wellbeing strategies tend to be a big document, which looks very nice and has a lot of aspirational stuff in it. And there's some efforts previously to sort of track outcomes in reasonable detail. But this joint health and wellbeing strategy is essentially a small, sparse document to which is attached some very detailed, very comprehensive action plans. That's going to be the focus of our activity moving forward. So you can see that the age well priority that was chosen by our consultation groups was priority 2, to help every Enfield resident prevent the risk of age-related ill health. And if we go on to the next slide, you can see how you've been developing. Oh, sorry, I do apologise. That's the outcomes framework, which dovetail things which are going on at NCL population health level. Can I have the next slide, please? Thanks. Now, developing the action plan, you can see how we did this. It's obviously a spreadsheet-based document, but these will be developed as we go along. And one of the things, again, I want to emphasise is that the Joint Health and Wellbeing Strategy is, to use that awful hackneyed phrase, a living document. We will be bringing this back to the Joint Health and Wellbeing Board as often as we need to, and reports will be going out to the Joint Health and Wellbeing Board and our partner organisation boards. And there's a bit of active work going on inside the council to work out how we're going to do that on a regular basis to update us to what we're doing. If additional initiatives come along, want to be included in that, they will be. And we have had some people say to us, why have you not referred to this? Why have you not referred to this? Well, we'll be going to. Now, it's going to be quite interesting because it means that meetings such as the Joint Health and Wellbeing Board, which have been, to use the words of one of my directors, something of a show and tell activity from now previously, will now on be very much program management meetings as well. And that's kind of a challenge for us. And I think the next Health and Wellbeing Board is on the 8th of October, which will be the last sort of show and tell Health and Wellbeing Board. The ones after that will be keep bringing these action plans back and keep bringing them back. And could I have the next slide? I've just abstracted from our action plan the age well priority 2, how it's actually fielded at the minute, and you can see it's actually sparse at the moment. There's not many items. It's deliberately sparse because this is the tranche 1 version of the action plan, which we're presenting to our those set above us in the council to get full approval from council, which I think is happening in January. We're almost there with that, but we are working on this. We are planning around this, and one of the things that we will be doing in Enfield quite a bit as a council is the things that we can do within the council in the patch to make a sort of healthier environment, even a health generating environment. And one of the areas we will be focusing on is obviously our housing stock. And I work quite closely with the damp and mold task force in Enfield in the housing team, and they work very, very hard to sort of draw down health risks associated with damp and cold houses. But we want to be able to metric that and see how we can actually improve people's health on that basis. And there will be other things going on at the environment of the council, but also when we talk about environmental challenges to health, it's not just physical ones, it's also economic ones. So I noticed there's some friends on the call from the Department of Work and Pensions, and we'll be in communication with you at some point. And this is going to be quite interesting. It's going to be quite challenging. And one of the things that I am concerned that we need to keep doing around this is to keep up with the quite extraordinary level of regular communication we have with our NHS commissioning colleagues. And I have to actually praise that. I'm pretty satisfied they'll be able to do that. But in the council, we have significant resource issues, particularly in the area of programme management, and we're trying to do stuff around that. But thus far, I'm quietly confident, and I'm actually quite excited by all this, but we still have a lot of work to do. And one of the things about this programme is it will be 6 years long. We're going for a long period, but there'll be formal reviews every 2 years. And I think I'm more or less done exactly on time.
Absolutely amazing. Thank you so much. And thank you so much for the slides. It's absolutely brilliant. Thank you, Mark. And it's really good to hear of all the things that you're doing to support, with the housing. And then we all know at the moment with the energy and the heating bills and everything else, it's going to be so important. So thank you so much.
Just one additional,
yes,
one more thing. I was actually doing some work in Tower Hamlets on Tuesday, and one of the things that came out, the focus of that meeting was on type 2 diabetes, but again, the importance of healthy, safe, secure housing. Thank you.
Absolutely. Thank you so much. Thank you. If you've got any questions for the speakers we've had so far, please put them in the chat. I'd like to take this opportunity now to invite Rick from the Age Well Health, Public Health Programme in Haringey. Are you there, Rick?
Yeah, I'm here. Thanks for the introduction. Yeah, so I'm going to talk about the just how we've used public health intelligence over the course of the last year to really kind of shape the work in the public health team, and also how it aligns to this programme. So one of the key areas of focus has been on the joint strategic needs assessment. So over the last year, we've developed really a number of JSNAs, as they're called. So these use a kind of the latest data and evidence to inform commissioning-based programmes. So one of these was done around adult mental health and older people's health. So I've included a link there, which people may want to look at. It includes data around loneliness, social isolation, common mental health disorders and dementia. So we've also plotted the data at small area level to try and understand how really factors such as inequalities across Haringey and the wider socioeconomic determinants such as worklessness, economy, and so on and so forth, physical health, can have an impact on people's mental health. So there's been a lot of work around that, and that's all included in the JSNA. And then we also worked on a cardiovascular disease data dashboard. So the dashboard again shows these small area level data for stroke, heart disease, and other indicators. We've also looked at the risk factors, really such as smoking, physical activity, and obesity to determine the relationships and correlation, again at a small area level, both at ward level and PCN level, to determine that the patterns in the inequalities identified, and also linking this to deprivation as well. Next slide, please. So this was taken from I think it's gone on one. Yeah, on. So this was taken from the JSNA on adults and older people's mental health. So it looks at dementia across Haringey, the prevalence amongst people aged 65 plus. So we've done some data analysis around this, and you can see there the data's presented at practice level. We've also looked at 2021 census data to really understand how the patterns relate to the older people's population at ward level in Haringey. So it's really important to look at although that's showing the percentages in that chart, it's really important as well to look at the number of people with dementia against the total number of people per practice, age 65 plus. So I recommend people having a look at the JSNA because there's quite a lot of information on there around dementia, which Paul's also kindly helped with, and that's included. And we've also included the recommendations around what could be done based on the data and intelligence. So it's quite comprehensive in that sense. Next slide, please. So this was in the data dashboard for cardiovascular disease. I think it's gone on the slide. So this shows a breakdown of the data at ward level. So it's for emergency hospital admissions for CHD. So you can see there's a strong correlation between factors such as deprivation and the standardized admission ratio for emergency hospital admissions. So really we've looked at the data and intelligence around other factors as well, such as the wider determinants, smoking levels, obesity, and physical inactivity, to see how these kind of trends do influence the factors for CVD. We recognised we needed to do a joint strategic needs assessment on cardiovascular disease because it was identified as an outlier for Haringey in terms of the premature mortality rate compared to the England average. So it was really kind of a priority as one of the JSNA's subject matter. Next slide, please. And then these are just some of the recommendations we've identified based on the data and intelligence. These are all included in the JSNA and also the data dashboard. So a lot of these relate to using data and intelligence more kind of to understand the unwarranted variations. So particularly around dementia, looking at where there's underdiagnosis of dementia across the borough, and really kind of working with GP practices to address that. Again, working towards a dementia-friendly Haringey. So, really encouraging organisations to sign up as per this the Age Well Friends Toolkit. And then for CVD, looking at one new Haringey. So my colleagues in public health work closely on these initiatives, primarily with a focus on CVD, but also across other areas of public health, including smoking cessation and improving rates of physical activity where they're lower than the Haringey average. And then, looking at the data across practice levels. So again, mentioned that briefly in the slides above, but really kind of interrogating the data at practice level and PCN level to understand the variations around CVD and also around the factors which can contribute to CVD as well. So that concludes the slides, and I'm happy to take any questions.
Thank you, Rick. That's amazing. You know, data is absolutely key, and without the data, we don't know how we can improve the population. And thank you for the plug with the Age Well Friends Toolkit. That's how we're going to actually be able to do things. Councillor, thank you so much for attending. I was wondering if you wanted to say a few words before you disappeared.
I mean, I think we all know, thank you very much, first of all, as I've written in the chat. Really useful, helpful and exciting work. As always, I've dutifully scanned and I'm awaiting info in my inbox to become a apologies, to become an Age Well friend. I'm still on Rick's point about dementia and some of those statistics, having met with some carers last week actually. So I think we all know why this work is just so important. And that's an example, having spent some time listening to those carers and people with dementia and their experiences. So thank you all power to the elbow. I know it's not easy work, but I look forward to hearing more about your progress of the project. And of course, always here if you need a supportive counsellor, as you know, share my email about. I'm always happy to hear from you all. Okay, thanks very much.
Thank you so much. That's amazing. Thank you. And so we've got to that point now where it's questions, and we're at the end of this amazing launch. But I would like to do one very quick special and like a thank you, a big thank you. And that's to Carly Watson. Carly Watson was with Paul at the very, very start of this whole adventure of Age Well, of mapping it out, what to do. And if it wasn't for Carly actually mapping it out at the very beginning, I don't think we would have got to this point. So I just wanted to say, Carly, thank you so much. It's incredibly kind, and it's good to see that you joined us from your new adventures as well. So thank you. I'd like to now ask, is there anybody who's got any particular questions? Is there anything anybody would like to add? Please put them in the chat. Please, as I was going to say, is I'm the Haringey Training Hub lead. Kerry, who was at the very beginning, is for Enfield. If you want to contact us directly, you can contact us directly about this programme. We're really excited about this, and what we really want to do is to be able to keep in contact and let you know how we're doing. But the most important thing now is to do a pledge. So I'm asking all organisations to say that they are an Age Well friend. It doesn't take 2 seconds, of your time to be able to go onto a QR code and to say, I want to be an Age Well friend, and I am an Age Well friend organisation. Once we start doing this, and if we can get everybody to log in, to actually put up their logos of their organizations, just think how fantastic that's going to be. So thank you so much. In the chat I can see, and we've got a question saying, is this for professionals? Can the links be sent to residents? So what we're trying to say is we're actually trying to say at the moment the friends are more for organizations, and I tell you why. It's because of the way individual people, we don't know who some people are. So we're trying to say if you're an organization, you can protect the elderly or people aging in a safe environment. And it was something that we did look at, because some people can be, you know, say, I'm an age well person, go and knock on the door, and, you know, awful things can happen. So what we're saying is, as an organization, you are like an age well friend. That organization is renowned, it's safe, it has governance around it, and then within that organization you have champions. And so within that organization, you become a champion, and that champion will support. That's how we're doing it. So we're not doing sort of individual residents at this moment in time. Is there anything that I need to add, Ellie, or how are we doing?
Thank you, Carrie. Just to encourage people to sign the pledge, and put a survey as well if people would like to complete the survey to see how they found this session. And in the survey also is an option to suggest any organizations or any other people that we should be approaching to get them involved now that you know about the program. But we encourage everyone attending today to please sign the pledge. Thank you.
Yeah, and just to say, as Paul has put in the chat, obviously this does include our knowledgeable VCSE colleagues who work with the older people as well. Absolutely, 100%, they're our champions. So thank you so much, everybody. And if there's no other questions, and we are absolutely on time, I just want to say a big shout out to everybody and to say thank you. Thank you, thank you. It's so exciting. And Kerry and I always say is we are actually age well. We're of that age. We don't think we're of that age, but we are of that age. And this means a lot to us. So thank you so much, everybody. And I'm going to say take care, and we'll be in touch. Thank you. Bye.
Thank you. Bye-bye.
Bye. Thank you.